Health experts recently lowered the range for high blood pressure readings, which means nearly 1 out of 2 adults in the U.S. now has high blood pressure.
And today we're looking at how those changes can affect your readings. With us is Dr. Jeffrey Anderson from the Intermountain Medical Center. Okay, so what can you tell us?
Well, first of all, why does it matter? And the reason it matters is that high blood pressure is a major risk factor for stroke as well as heart attack. And so it's important to understand, what the ideal blood pressure is and what to do about it. This new guideline is the first full rewrite in 14 years, and a lot has happened since then, a lot of new studies, new treatments, so it's very important that we get updated on that.
What do you personally think about this, though? I mean, do you think this is the right thing right now? Because all of a sudden it puts 46% of adults in this high-risk category.
Right. Well, we were involved in this major study that made the change, Intermountain Medical Center, and all of those that wrote the guidelines, had no relationship with industry or pharma, so we believe it. But it's important to understand that if your blood pressure over 120 over 80 up to 130, we call it high blood pressure, but we want to emphasize diet and lifestyle, and we think that's important for all of us as Americans. And then above that, above 130 instead of 140 is where we start thinking about using medical treatments.
So this is more about really changing just your overall perspective on your personal overall health and trying to make some changes before it gets really bad, it sounds like.
Yes, and the other thing to emphasize is how we measure blood pressure. Since these guidelines are now more restrictive, we want to have it done on multiple occasions by a reliable method, not after exercise or eating or a hot shower or smoking or drinking, and on multiple occasions when you're relaxed. And so your blood pressure will tend to be lower on those occasions, and then we want to make sure that it's done multiple times with an accurate instrument. But then if it's, despite all of that, elevated, we think that there's a need for us to maybe change our lifestyle, review it with a physician, and that'll lead to better quality of life as we get older.
Now, if I'm not sure if my blood pressure is in par with those guidelines, any key tips that I need to keep in mind?
Well, in terms of diet, we eat too much salt, so lowering that helps. Fruits and vegetables are a diet called DASH, the DASH diet, which you can look up on the internet. And, I think that's one we ought to recommend along with regular exercise.
Okay, so when I first read this, I thought, okay, this is the insurance industry here. So because for a lot of people, their life insurance premiums may go up as a result of this as well. But you're saying that these two are not at all aligned.
Exactly. In fact, I was chairman of the Guidelines Committee when we set up the committee to do this, and to qualify to be on the committee, you could have no relationships with industry or with insurance. So this is just pure science. And then it was reviewed and reviewed. This has been in the making for over 3 years. So I think this is a real reliable guideline that is good for your health.
Okay, we may as well say it. So it looks like, normal is now 120 over 80, elevated 120 to 129 over 80. Stage 1 hypertension, so like pre-hypertension, is that what you call it still?
Well, we actually eliminated pre-hypertension. So no pre-hypertension, it's just elevated blood pressure, and then, as you say, stage 1 hypertension.
And then stage 2 is 140 plus over 90. Yeah. So what do we do then? What kind of lifestyle changes really quickly do we really need to make?
Right. So as far as diet goes, again, less salt, watch our calories, don't put on weight. Weight doesn't, losing weight will help.
And then exercise.
Exercise,
sounds
regular
like a major component for this.
Absolutely. So 30 minutes on most days of the week, or if it's more leisurely, even longer. Those are important things that will help our blood pressure.
You're just trying to keep us alive, aren't you?
Yeah.
You just want to keep us alive longer, huh, Dr. Anderson? Hey, thanks a lot for coming in. Appreciate it. It's good info.